You may not realize that Medicare doesn't cover everything. It is annual enrollment time. So if you're considering making a change, now is the time to do it and consider your options. Here to talk about all of those options, Kathy McVeigh with Optima Health. Thanks so much for talking with us today.
Thank you for having me.
So help us understand, what is included in Medicare?
Original Medicare is your Part A, which is your hospitalization. And most people, that comes to them at no cost because you've worked enough quarters in your life. Part B is the medical benefits. That's your outpatient doctors and maybe your labs and x-rays. And Part B, you pay for Part B, and that's based on your income. And Medicare bases that on your last year's tax return, whatever was on your tax return last year, and that's what you will pay for Part B. And it comes out of your Social Security check automatically. So what happens with that is Medicare A and B, they don't cover everything. There's a little bit of a gap in what you would have to pay. And that's when folks have to look at whether they want to get a Medicare Advantage plan to help kind of close that gap for them.
Okay, so talk about then, if you were to get additional coverage, the Medicare Advantage, what's included in that?
Medicare Advantage plans cover, the biggest thing that it would cover that Medicare does not would be prescriptions. Okay. Your original Medicare does not cover prescriptions for you. So a Medicare Advantage plan, we call these plans Part C. Okay. So we kind of wrap our plan around your Medicare, your original Medicare, and we offer your Part D, which is your drug benefit, all in one.
Okay. And so it really is the comprehensive, everything you may need in terms of healthcare coverage.
It is. It is very comprehensive. It's going to leave you with little to no copays out of pocket for you.
Okay, so it is annual enrollment period. We talked about that. In terms of the deadline, what does that mean for getting additional coverage?
You must make that decision by December the 7th.
Okay.
That is the only time that you have to make these changes as a Medicare beneficiary.
Okay. Who is the ideal person to get this Medicare Advantage, which is on top of Medicare benefits they may receive?
Yeah, so that would be anyone who has Medicare Parts A and B. They're qualified. So it could be someone who's over 65, or it could be someone who is disabled.
Okay.
If you're disabled and you have Medicare, you can join our Medicare Advantage plan.
But in terms of screening, what would be needed to get that Medicare Advantage and be eligible for that?
We don't have any screenings. Medicare prohibits any kind of screenings for the Medicare Advantage plans. And so there is no screening. There's no pre-existing for our members.
Okay. People might have questions. Where can they go to get some answers?
They can call one of our plan advisors at 855-434-3267.
Okay, thank you very much. And again, the deadline is coming up. It is December 7th. Kathy McVeigh, thank you so much.
Thank you.